Thank you, sir. Thank you. Okay, thank you, Hindi team. Thank you, Savani sir, and thank you, Gupta sir. Thank you, everyone. Now we are moving to English session. Today is our 1527th day of continuous webinar. Thank you all the participants for joining with us. Let's start our meeting with a silent prayer. Good evening once again. Today's our guest is our host. She is not our guest. Dr. Neha Kakkar. She's B.H.M.S. She's a practicing homeopathy physician and owner of homeopathic care in Meerut, Uttar Pradesh, and member of Meerut Homeopathic Association, and member of Red Cross Society, and member of Delhi Homeopathic Association. Presented papers on the topic of cancer in homeopathic cancers, homeopathic etiology and management at India Homeopathic Congress in Hayat, Delhi. And more than this, more than other qualifications, she is the chief moderator of our IFPH. And I am welcoming Neha ji to our today in different role. I am welcoming you. Before also she took 2 classes. So welcome.
Thank you, Dr. Ajni, for the wonderful introduction. And as she said, I am more of a host than a presenter. But yeah, I try my best to be as good as a presenter as I can become a host. So today the topic which I will be presenting is a topic I previously presented in Hindi already. And the topic is fibrocystic disease of the breast and its homeopathic management. So fibrocystic disease is a term which we come very often nowadays, and it is a very common problem that is occurring in obviously women because it affects the female breast, and people are more skeptical about this nowadays because they think that it is a more of a precursor of cancer. In the in the coming time, they think that it is a precursor of cancer, and if they have this kind of benign growth or any growth in the breast, it can lead to cancer. But obviously it's a misconception. But this disease is quite cumbersome because it causes some symptoms of pain and other things. So today we are going to discuss the basic things, the etiology and the risk factors and the diagnostic procedures and all other things associated with it, and obviously how homeopathy can help us in this curing this problem of fibrocystic disease. So moving on with the slide. To understand what exactly is fibrocystic disease, first we'll understand what is the normal structure of the female breast like. So the normal structure, as you can see here, we have the main the mammary ducts, the ducts which carry the primary function
Doctor,
of milk production.
Doctor, excuse me. Are you
Yes.
sharing the slide?
Yes.
I
Are
cannot.
you, okay,
No,
okay,
no,
sorry.
not visible.
Just a second. So so to understand what exactly is the fibrocystic disease, first we need to understand what is the normal structure of the breast like. Now as you can see in these two pictures, we can see the normal ducts or the milk producing ducts which we can see here, which is the primary function of the breast, where the milk production is happening, and through this nipple or the ducts which the milk is ejected through the breast. So this is the basic structure of ducts, and in between the ducts we can see the fibrous tissue, which is the supportive tissue of the breast, which gives support and shape to the female breast. So this is the area where the fibrocystic disease or the fibrous changes which occur and can causes symptoms to the patient. So the main area which gets affected is the fibrous tissue, not the ducts exactly. There are sometimes where the ducts are also involved, but basically this fibrous or the connective tissue, the supporting structure of the breast, is the main area where the fibrous changes take place. In the next slide, as we can see, what is exactly the fibrocystic disease of the breast? Fibrocystic disease of the breast is a benign condition. As I always say, people are very skeptical, patients are very skeptical that it can lead to cancer, but it is a purely benign condition. And obviously sometimes it can turn into cancerous, but obviously there are some risk factors which are important to change it into a cancerous situation. But normally it is a benign condition and it can be very well managed with homeopathy. So here, as we see the what exactly the fibrocystic is, as you can see here, in between the ducts we can see cyst formation and growth formation, where the fibrous tissue of the breast is affected. There is cyst formation there in between, and the ducts are not involved. Mostly the fibrous tissue is involved in between the ducts, and that is the basic structure where the fibrocystic disease is affected in the breast. And as the name itself is suggesting, fibrocystic is obviously the cyst formation. It is always mostly fluid built. We can have other tumors like fibroadenoma, which we'll see further in the slides, where we will see the difference between the fibrocystic and the fibroadenoma of the breast. So now moving on to the prevalence, how common is this fibrocystic disease of the breast? So according to the statistics, as we can see that 30 to 75%, I mean, it's quite a number of the population is affected by these fibrocystic disease. And in nowadays, in the current scenario of modern, society, we can see that incidence is increasing day by day. And the most common age where we can see this fibrocystic disease occurring is the age of 30 to 50 years, which is quite theoretical. But in practically, if we see the cases coming in our daily practice, we can see that the cases are coming as early as around 18 years or 20 years of age. Also, even before that, because the hormonal changes have taken a shift in the recent times due to the sedentary lifestyle and obviously the diet factors that are coming across, and other factors of early maturity in the girls, which is happening because of the social media. So all these factors we will see further, also we'll see in detail. All these factors are also affecting the increased incidence of this disease, and also the early onset of this disease is coming in early ages. So these factors can be seen playing a role in that. And the next and it's obviously, as I have told you, that its incidence has increased in recent years, which we'll see the factors in the upcoming slides. So basically, we are saying mostly the girls and women coming across with this problem of fibrocystic disease, and it's getting very common. I mean, I would say that around from in every 5 woman patient, or any girl patient which is coming to you, every 1 out of 5 patient is having this problem of fibrocystic disease. Next, we see that what exactly is the clinical representation of fibrocystic disease of the breast. Now, the most commonly the patient which we come across in fibrocystic is that they complain sometimes that there is heaviness in the breast, or the breast is quite bulky, because not on every time we see that there is a nodular growth or a cystic growth. When we palpate the breast, we see that not every time we see a mass, we see more of a bulky and heaviness representation of the breast, because the hormonal changes are always there associated with the fibrocystic disease of the breast, and the menstrual cycle is also affected. So the mostly we see a patient mostly presents with painful breast before or during menstruation, or otherwise also the breasts are mostly heavy and tender, and before and during menstruation the patient is having tenderness and pain is the best. And sometimes, as we say, the presentation is that of well defined cyst or lumps, but sometimes we only get to see bulky breast which are tender. So we give both a type of presentation, where we can see the heaviness and bulkiness, and along with that we can see the formation of cyst and growths. But on the other side, we can say only cyst and nodal growths, or we can see the bulky breast. So we get 3 types of presentation, where we see only bulky and tender breast. Then we have definite growths like cysts and growths coming, and where we have a mixed representation, where we see cyst and growths along with the bulkiness. And as I've mentioned before also, that there are menstrual irregularities also associated with oligomenorrhea or amenorrhea, that is scanty menses. The menstrual cycle is definitely affected, and due to that hormonal change which is occurring inside the body, mostly these fibrocystic disease gets started in the body. So we'll see the risk factors in the upcoming slides. So coming to the risk factors associated with the fibrocystic disease of the breast, hormonal changes and disruption in the menstrual cycle in the female body, which is the most common cause of development of fibrocystic disease. As I have mentioned before, that the lifestyle which we are following nowadays of sedentary lifestyle and more emphasis on junk food, because of maybe that may be a reason which we cannot avoid, because mostly the mothers are working out nowadays and they are not able to pay much attention to their kids. So this can lead to more of the food habits becoming more easy, and children eating more of packed food items, and which has lead to more of obesity, and also sedentary lifestyle coming up because of less of exercise. So these all factors are actually hampering the hormonal changes and the menstrual cycle in the body, and which is the main cause of development of the fibrocystic disease. So as I mentioned, these all factors are playing in together as a role, and they are disturbing the menstrual cycle, which are leading to formation of this very common disease which are affecting the females. Second factor, as we can see, the third factor, the smoking and the alcohol consumption, which is also becoming a very common thing in the females, which is also disrupting the hormonal cycle of the female. So ultimately the hormonal cycle is getting affected, which is leading to these changes. All these factors are acting as a precursor, or are acting at the back side, this faulty diet, the sedentary lifestyle, smoking and alcohol consumption, which is leading to the disruption of the hormonal cycle and ultimately to development of fibrocystic disease of the breast. And the fourth factor which we see is that of a psychological stress. As I mentioned before also, that the females are working, they have to manage both home and the workplace, and the stress factor is more, the onus is more on the female, because she has to handle, ultimately even if she is handling the work outside, she has to handle the work inside at home, she has to handle the kids, and the onus is always on the female. So the onus which is acting on the female is leading to an increased disruption of the hormonal cycle. The pituitary axis get disturbed, and ultimately the estrogen and progesterone is also disturbed, which can lead to oligomenorrhea and sandy cycles, and that will ultimately leads to formation of the fibrocystic disease of the breast. Now this is a very common thing which we are reading in the newspapers every day, but this is the basic thing that is which is occurring. And leading, because whenever we are coming up with the patients in the clinic also, we are always advising them for improving their lifestyle, taking a more healthy lifestyle with more of exercise and decreasing the junk food level, and practicing meditation. So all these things are very much part of our treatment plan along with the homeopathic medicine, and without it the treatment is always half done. So we need to keep these factors in our mind, and same is the case with the PCOD. So this picture presentation of PCOD or fibrocyst, where we are getting cystic formation or fibrous formation, or an overgrowth, that is because of these things, and we need to keep these things in mind at a very important level. Now very commonly we get to see some other presentation of the growths in the breast, that is fibroadenoma of the breast. Whenever we see most of the ultrasound or mammography reports, we see both the presentations where we see the fibrocystic disease of the breast also and the fibroadenoma. So now what exactly is the difference? Obviously these are like the representation of the same disease, the hormonal changes which is occurring inside, but the representation is different. The fibrocystic and fibroadenoma, you can say they are the two sides of a same coin, because of the difference in representation. So as we see in fibrocystic disease, there are fluid filled soft lumps. They are fluid filled lumps mostly, as we say, the cyst name itself, it says that it is fluid filled. Cyst is always fluid filled, so they are fluid filled lumps. And fibroadenoma is a solid, firm, and very hard lump. Whenever you palpate a fibroadenoma, we can say it is very, hard in texture, and it is very much, palpable. But cyst is mostly vague in palpation, because it is always moving and it is very soft in nature. So that is the difference which we come across in these two. Mostly the fibrocystic are present in multiple numbers and are smaller in size. Fibroadenoma of the breast is bigger in size and are mostly solitary in number. They are big growths which are coming up in the breast, and mostly solitary in number. Now, this fibrocystic disease does not contains fibrous tissue. Whenever we go for the FNAC or the biopsy inside them, we don't see more of tissue changes, but it contains more of fluid things, as we have seen before. And this contains mostly fibrous tissue. And this occurs mostly due to hormonal changes, but these growths can occur spontaneously also. But like when we see more of, like lipoma growths occurring in a patient other side in the body, like in the hands or in the legs or any other parts of the body, which also contains fibrous tissue. So fibroadenoma can be due to hormonal changes also, but it can be also due to the other growths or the psychotic growths which are coming up in the body. So fibroadenoma can be the part of that also, but fibrocystic growths are mostly mainly hormonal growths. Now, these fibrocystic growths can also be treated with FNAC. Now, mostly people here must be knowing that FNAC is a fine needle aspiration cytology, through which we aspirate the fluid inside the cyst, and we get to see what kind of cells are present to confirm that it's not a cancerous growth. But this is also along with being a diagnostic procedure, this is also a treatment part where we drain out the cyst. And mostly this is the most common treatment taken up for the fibrocystic disease of the breast. But fibroadenoma mostly needs surgical excision most of the time. Matlab, they say that the the patient needs to go for a surgical removal of this. So these are the main difference, five difference which we see in the fibrocystic and the fibroadenoma of the breast. The only similarity is that of being pain. The fibrocystic disease is also painful, and the fibroadenoma is also painful. But what is the difference in pain? The pain is more diffuse, and the pain is more localized and more tender. Whenever you touch a fibroadenoma, you will see the patient just pulls back himself, because it is more it is pressing on the outside surrounding tissue, being more hard and solid in nature and containing fibrous tissue. It is pressing around on the surrounding structures, on the nerves, and so that's why it's causing more of pain and tenderness. While a cyst is, because it is fluid filled and it's not causing more of pressure symptom, the pain is mostly diffuse. So these are the basic differences which we can, differentiate the fibrocystic disease and fibroadenoma. Obviously, the treatment wise, if we are talking about the difference is not much, because the medicines which we are using to treat both the diseases can be mostly overlapping most of the time. But still, for for understanding purpose, we need to see these differences. So in this picture, you can see the different type of growths which we see in the breast. Here we can see there can be an abscess. When the growth is pus filled, then it is called an abscess. When there is more of fibrous tissue, we call it a fibroadenoma. When it is more of a clear fluid filled, then it is called a cyst. Then we have fibroadenomatosis, where we have growth more of more different types of tissues, fibrous tissue coming up together, cyst also and tissue also, that is coming together, that causes fibroadenomatosis, and this is a cancerous tumor. So these are the basic types of tumors which a breast gets affected. And for understanding purpose, we need to understand it. But otherwise, treatment wise, mostly, as I told you, that medicines can overlap. But for understanding person, we need to understand for diagnosing the case, we need to understand that whether is an abscess, it is a fibroadenoma, it's a cyst, it's a tumor, and what kind of growth it is. Coming to the diagnostic procedures which we see for fibrocystic disease is, first of all, obviously the clinical examination. We palpate the breast lumps and we see if it's more of diffuse growth, we see as of a more fibrocystic growth, or otherwise we see it as a fibroadenomatous growth. Then we have mammography, which is the most common diagnostic procedure done. Mammography is mostly advised with the mostly gynecologist and other general physician doctors to diagnose this procedure. Third is ultrasound of the breast to differentiate whether the lump is solid or fluid filled. Obviously, the ultrasound will confirm whether it is a fibroadenoma or a fibrocystic growth. Then we have a fine needle aspiration cytology, that is FNAC. It is both diagnostic and used as a treatment option. And then we have a breast tissue biopsy to rule out that the cyst or lump is non-cancerous. Obviously, this FNAC can also confirm that it is not a cancerous growth, but biopsies is also taken to confirm that it is not a cancer growth. And most of the time the growth is non-cancerous. The patient is very fearful about this, that the growth is cancerous or not. But we need to make the patient understand that mostly these cases are very easy to treat, and surgery is not needed, because surgery often leads to regrowth of these structures coming up again, the cyst coming up again, or the adenomas coming up again. So we need to make the patient understand that it is a completely curable condition and it can be very easily managed by homeopathy. So coming up to the homeopathic perspective on fibrocystic disease, first we see the miasmatic background which is coming up. We see that both sora and psychosis is there, because it's an overgrowth. Obviously the psychotic miasm comes into factor, but as we say that sometimes only the symptoms are present of bulkiness and heaviness. So in that cases mostly sora is present behind the growths, and psychosis is coming up when there is a fixed growth or any other growths coming up, like warts or any lipomas or any other growths, or history of fibroids in uterus coming up. Then we see more of a psychotic background. But if the symptoms are on more on a functional level, where there is bulkiness, heaviness, and only pain in the breast, and scanty menses are there, and no history of any other growths coming up, or no family history of things coming up, so there more of sora is there in the back. And the third miasm that we come up is of tubercular miasm. Syphilis is more coming up when syphilitic miasm more comes up when there is a cancerous growth coming up. So here I have not taken up the syphilitic background, because we are only discussing the benign growth of the breast. So more of tubercular miasms are sora or psychosis, and tubercular miasm also comes up, because I have personally also seen in cases where there is history of tuberculosis, whether it is a history of tuberculosis of the lungs or the tuberculosis of the lymph nodes or of the intestines, then also we can see this growth coming up. So tubercular miasm is also an overgrowth miasm. So this can also be considered very well here. So sora, psychosis, and tubercular are the three main miasm which we take in when coming up with these fibrocystic disease cases. Now there are as n number of medicine to treat the overgrowths, but here I have compiled some medicines which I have used mostly in my practice and in my experience, and which when we take up mostly the history of scanty menses and other oligomenorrhea and amenorrhea cases, and using that, and mostly the hormonal changes which we are coming up, so we see these common medicines which we use in the treatment of fibrocystic disease. First, the most commonly medicine, and which I have personally used, is Brinia, where there is pain in breast at menstrual periods, and breasts are hot and painful. Aggravation of pain on motion. On slightest motion, there is pain, and there is stitching pain in the breast, right-sided growth, and which is a great sister remedy. So Brinia is a very great cystic remedy, whether it's PCOD or whether it's fibrocystic disease, or even when there are any other growths like stones. So whenever there is stitching pain, the characteristic stitching pain of brainia and aggravation of pain on motion, we can always think of this remedy in fibrocystic disease. Second most useful medicine is calcarea carb, which is mostly used in higher potencies where the females are suffering from irregular and scanty menses. So obviously there is irregular menses, and patient is fat and flabby and chilly and deficient assimilation and sluggish circulation. So the where the periods are mostly affected, and we see this characteristic picture of calcarea carb with sweating cupping up on the head or in the feet, or more of a obese person with scanty menses and sedentary lifestyle. So we always think of calcarea carb in this case, and mostly in 1M and 10M potency, this gives a very good result in fibrocystic disease. The third medicine is obviously calcarea floor. Calcarea floor is mostly used in fibroadenoma of the breast, in hard stony growths. Hard knots in the breast are coming up whenever there is very hard and nodular growth coming up in the breast. We think of calcarea floor, and mostly used in fibroadenoma. Next is lycopodium, where we have left sided growths, irregular menses, slow yet steady development of cysts in breast, and disease of breast associated with digestive complaints. So lycopodium is also a cystic remedy, I might say, because it treats cysts very effectively. So mostly used in fibrosis, not than in fibroadenoma, and mostly left-sided growths. And obviously we need to have digestive complaints and other symptoms of desire for sweets, and the patient is more of introvert in nature. So whenever we see this kind of a drug picture, and lycopodium is less commonly seen in females, still if you get a more of a reserved patient with cystic growths coming up, and with a psychotic background, then we think of lycopodium as the remedy. Then we have Asterias rubens, used both in benign and cancerous tumors of the breast, dull aching neuralgic pain in breast, and swallowing breast. So this is a very good remedy in lower potencies where we see both benign and cancerous growths. The growths of Asterias rubens are also very hard in nature, and they can be used both in fibroadenoma and fibrocystic disease. Then obviously we have conium, which is a great glandular remedy when we see all the glands coming up and swelling up of glands before and during menstruation, painful breasts, and growths of other glands. Menstruation is delayed and scanty, and there is suppressed sexual desire. We need to take the sexual history more in the when we are probing on conium, and we see are coming that conium is coming up the remedy, then we need to probe on the sexual history, because there is great sexual desire suppression there in conium. So we need to see this that part and that angle in this whenever we are thinking of conium as the remedy. Phytologa, once again, a very good remedy in fibroadenoma of the breast than the fibrocystic. Whenever there is tender breast and heat and inflammation and very, very painful breast, then we ought to think of Phytologa. And Phytologa also has given me a lot of good results in fibroadenoma of the breast. And the other symptoms, as we see of phytologa, which we come across, is galacturia, very tender breast. So the main basic symptom is whenever you get the basic tenderness and painfulness and great inflammation, even redness outside the breast, we think of phytologa as the remedy. Next is Scrophularia nodosa. It has special affinity for the breast, very useful in breast tumors, multiple nodosities in the breast region, and pain in the breast. So this is also a glandular remedy. This Phytoloca, conium, Scrophularia nodosa. So these are all glandular remedy, and we need to see the differentiating factors before selecting all these remedies. Conium is more acting on the sexual sphere. Phytoloca is more of tenderness, and is about more of tenderness and inflammation. And Scrophularia has cold swellings. Cold means the growth is there for a longer period of time, and then we need to think of Scrophularia nodosa, and it is there, and maybe the pain also might not be there. Also sometimes pain might be there, but even if you get cold swellings, then we need to think of Scrophularia nodosa. Then obviously when we have, as we taught about tuberculinum, where we are having the tuberculinum tubercular background, so we see a tuberculinum coming up. And this remedy also acts as an intercurrent, a very good intercurrent, whenever there you have given the constitutional, but after some time the case has stopped, so we can think of tuberculinum as the remedy. And there is definitely history of tuberculosis. There can be tuberculosis of the lungs or of the lymph nodes of any other place, so tuberculinum can act as a very good remedy. Obviously, then there is thuja with antipsychotic treatment for tumors and growths in body, hydrogenite constitution, breast growths along with wart-like growths in the body, menstruation is scanty and retarded, and severe pain in the breast region. So the all kind of psychotic growths call up for thuja. And obviously, this can also be used as an intercurrent for fibrocystic and fibroadenomatous growth. Then we have silicea, which is mostly used in abscess of the breast and non-absorption of scar tissue. Whenever there is a scar tissue growth and some injury is also there at the scar tissue, and that can lead to development of any growth, then silicea will come into action. Tumors occurring due to imperfect distribution of nutritional substances in the body, and the other symptoms which we get of pin mania, haughty nature, and obstinate female. So whenever you get to see all these symptoms or of scanty menses with this characteristic duck picture, we can think of Licia as the remedy. Then we have pulsatilla, where we have scanty and irregular menses, and obviously weeping tendency, and the thirstlessness and other characteristic symptoms of pulsatilla. We can think of pulsatilla. And pulsatilla also acts in very good in higher potency like 1M and 10M, and can get very good result in the fibrocystic disease of the breast. So obviously the medicines are overlapping, but some medicines are acting more on the fibrocystic disease and some medicines are acting more on the fibroadenoma of the breast. Now, moving on to the cases of fibrocystic disease of the breast, let's take up the cases one by one. Here I'll be showing two cases of fibrocystic disease which I have treated with homeopathy. So the case one, we see the presenting complaint of a 20-year-old lady. So you can see a very young lady coming up in January 2023 with complaint of bulky breast and with small nodular multiple lumps in the left breast. She also had complaints of missing periods since the past 2 years. So she came up with the complaint of bulky breast and small nodular multiple lumps in the left breast, along with the complaint of missing periods since the past 2 years. So moving on to the history of presenting complaints, we have the patient started having the problem of missing her periods after every alternate period. Every alternate period she used to miss, and the patient decided not to take any medicine for this problem and had the same pattern of her menstrual cycle continued for 12 months. That means for 1 year she used to have every other period being alternate period being missed, but after the period of 1 year she started having the complaint of bulky breast and also felt the presence of small noodle structures in the breast. So the main complaint, as you can see here, started with the disturbance of the menstrual cycle. The menstrual cycle was initially developed where the alternate period was not coming up, and then she started having this growth of small nodular structures coming up her in the left breast. Also they were painful on touching and her periods became more erratic. So we can clearly see the hormonal disturbance here, where the periods are affected and ultimately the growths are coming up due to the disturbance in her periods. And the patient who was coming up for the treatment was studying in college and was doing her BBA. So she was quite a young person and young patient, and but was starting up with these complaints. So on probing on the further history of past history, we see nothing specific coming up, and the family history was history of tuberculosis of lymph nodes in maternal uncle. That is, his mama had tuberculosis history of lymph nodes, And on the menstrual history, as we see the history of missing periods on alternate months for 1 year, and then for the next year she started having periods after every 2 months. That means 1 month she had her periods, and next 2 months she had her period myths. Then in the fourth month the period used to come. So this was the pattern that came up. So that you see the cycle became it started deteriorating in character. But the main thing which we see in this case, we'll see further in the case. So coming to the physical journals, the appetite was normal, thirst was normal, desire for junk food, eating food outside, aversion, nothing specific. Physical and more of physical journal, we say stool sometimes constipated, urine was normal, perspiration was normal but sometimes offensive, sleep was normal and refreshing. So the mental journal, so the characteristic thing which we see here, that patient had an easygoing personality, she had a daring attitude towards life and was not bothered so easily, showed in negligence of her health condition, was not angered easily and did not keep grudges, she was quite satisfied with her life. And so because the patient was not taking any treatment for this, when she came to my clinic, she said मैंने इसके लिए I am not taking any treatment because this I think that it will go it on its own, because it's just a complaint of periods and this cyst might come up and they'll go herself itself. And because the patient was very much careless about this thing, that she was not bothered that what will happen to her, or whether her periods are getting missed and there is a the fibrocystic disease is coming up in her breast. She was quite negligent about that. So this was the basic thing which I came across. Physical constitution was tall and slender with narrow hips. And on physical examination, the other thing, vitals were normal, but the breast confirmed the presence of multiple small nodular lumps in breast, which were very painful to touch. And multiple lipomas were also there, fat growths on both the hands. So there were multiple growths also there in there. So the tubercular miasm was very much coming up in this case. And as we see the tuberculinum remedy also, we see that this think of easygoingness is there. Whenever we see the tubercular patient, we see more of easygoing nature in them. So the remedy which we see is mostly coming up, but obviously ultrasound and mammogram was advised, but the patient did not get these done as she did not want to undergo any test for this condition. She was quite laid back for this thing. And so repertorization was not done on software. Treatment started based mainly on complaint of missed periods and family history of tuberculosis. And as I said, the easygoing attitude pointed towards more of a tubercular miasm. And the first prescription which I gave was tuberculinum 200 single dose for 3 days, consecutively followed by Janosia Ashoka mother tincture for duration for the next 15 days. So mainly tuberculinum was started and Janosia was given for her complaint of missed period. After 15 days on the second follow-up, we see there was no relief in the breast complaints and period was not started. Obviously, in 15 days, nothing came up. And again, tuberculinum 200 were prescribed, followed by Janosia mother tincture. On the third follow-up, slight relief in bulkiness of the breast, 2 nodules reduced in size, periods were not yet started. So tuberculinum started to act upon this case very quickly, and the bulkiness of the breast was reduced. And also, as there were multiple nodules, 2 nodules came to come to reduce in size, started to reduce in size. So the patient was put on Saclac and Janosia mother tincture was continued for the next 15 days. On the fourth follow-up, period started, but flow was not very good. One more lump was, less palpable was there. Then tuberculinum 203 doses were again prescribed with Janosia mother tincture. On the fifth follow-up, breast complaint better by 60%. Saclac given for treatment along with Janosia mother tincture. Again, so the Janosia was continued because the periods, need to be corrected very much, because the main cause was that of period. Obviously, the tubercular miasm was acting, so that had reduced the sizes, but the cycle needs also be corrected. So Janosia was continued. Periods came the second time. First time in 2 years got her 2 consecutive periods. So as we can see that both the medicine has acted in this case and led to the continuity of the periods. So in first time in 2 years, two of her periods came consecutively, one after another. Flow was better than the last period. Seclac was prescribed for 15 days and no mother tincture was given at this stage because two periods had come. So I stopped the mother tincture there and waited for more further action of the medicine. On the seventh follow-up, breast complaints were a lot better. Patient was very much satisfied with the treatment. Given Saclais was prescribed along with again Genosia mother tincture. For on the next cycle, again I started the Genosia. Periods came, but 3 days late, but flow was much better. But obviously, the previous medicine was acting, and so the periods came, but a bit late, but the flow was much better. Patient continued this treatment for 2 more months. That in total 5 months treatment was taken, and her periods returned to normal, and the breast complaints were almost 90% gone. So we can say very easily that how selection of tuberculinum and just for the correction of the menstrual cycle lead to very easy relief of the complaints of the patient, and very easily the patient was better even in the period of 5 months. So we can see that fibrocystic disease can be very effectively managed with homeopathy. Coming up to the next case, presenting complaints of a 40-year-old woman. So this case was of a elderly woman with presented in April 2024. The complaints of tenderness in both breasts along with two localized lumps, one in the right breast and other in the left breast. And she was advised for excisional surgery by allopathic doctor. Obviously, she consulted the allopathic physician because she had quite big growths in her both the breast and there was tenderness there. There was painful rest. So she consulted the allopathic physician and was advised surgery. So patient started having complaints of painful and sore breast before every period since the last 8 months. Since last 8 months she had it painful and sore breast before every period. She used to have pain in the breast and the breast were also bulky. While when on seeing on the breast, she had bulky breast. She also started to feel development of two well localized masses in both breasts since last 5 months. One of the growth was present since college time, but since 5 months had grown in size. The growths were more painful before periods and also during periods. Stitching pain in the breast, the pain subsided after the period stopped. Consulted a gynecologist for this condition, and the doctor advised CT scan, which confirmed the diagnosis of fibrocystic disease with fibroadenoma, and was advised surgical excision of the same. So she used to have this complaint during her college time. As you can see here, that during college time she had first started to have this complaint of fibroadenoma and fibrocystic disease, and she took homeopathic medicine at that time, but after that it subsided. But again, after almost a period of 10 to 12 years, she started to again have these complaints after marriage, where the growth suddenly started growing in size. So obviously CT scan was again done and it confirmed the diagnosis of fibroadenoma with fibrocystic disease. So here in the past history we can see that she uh, took for the same allopathic treatment and also homeopathic treatment she take, and it was better by homeopathic treatment. Also gave her some vitamins and also hormonal treatment was taken also at that time previously, and the lump had subsided in 6 uh, but did not go away completely. The breastlet subsided but did not go away completed, and she also had jaundice ventricular. So the past history showed that it was better with homeopathic medicine and also with some vitamins and hormonal treatment, but it again had come up this time. There was family history of CA breast of mother. Her mother had a cancer breast, and menstrual history was not very specific. She had regular menstruation flow for 5 days with pain in right abdominal region and no glucoria. So there was slight pain in the ovarian region in the right abdominal region during menstruation, but the menses were normal in character, but no scanty menses were there. Obstetric history: no abortions, two children through normal delivery, age 12 years and 10 years. And the physical generals were quite okay. Appetite was normal. Thirst was felt thirsty repeatedly, desire for salty food, aversion, nothing specific. Stool was normal, urine normal, perspiration normal, sleep was normal and refreshing. So the basic things which we are coming up here is the feels used to feel thirsty repeatedly, and uh, right abdominal region, stitching pain, and pain also growths in the right and left breast. Then we coming up to the mental generals. She was very angered easily, used to shout and say harsh words in anger which hurt others, used to feel guilty later. Brooding nature, used to worry on past events, and also anxious by nature, made hasty decisions due to the anxiousness. So she was very quite an irritable lady. She used to get angry very easily. She used to shout at other people whenever angry, and used to feel guilty later. And brooding nature was also there. So the psychotic nature is coming up here also. And on the modalities and character of pain, stitching pain, because the pain was very much there, so I took up the modalities and character, where we see stitching pain in both the breasts, especially before periods. Pain was aggravated due to the slightest motion. Physical constitution was normal, nothing specific, weight of 60 kg. Physical examination was quite normal. With breast physical examination, we see presence of two small ball-like lumps. So there were quite a big small ball-like lumps in both breast, very painful on touching. Investigation CT scan breast confirmed the presence of fibroadenoma with fibrocystic disease on both sides of the breast. Advised surgical excision of the masses. FNAC was also advised to rule out malignancy in the case. FNAC was done, but it was not malignant. In spite, she had history of CA breast of a mother, but it was not a malignant case. So obviously, this case was also repertorized manually and took the following rubrics, where we see fibrocystic or fibroadenoma of the growth of the breast, stitching pain in the breast lumps, stitching pain in the right abdominal region, irritable personality, angered easily, excessive thirst, and brainia was the remedy coming out after manual. So we see brainia coming up here, but the case was started with a dose of carcinosin 1M because of the cancer history her mother was having. So I started with the dose of carcinosin 1M, and then Prinia 200 was also prescribed for 1 week with single dose of Brinia in the morning and placebo in the evening. So for 1 week, I gave carcinosin 1M, and the following week, I kept it up with the constitutional Brinia 200. Second follow up, no change in the growth. Periods had started. Periods were obviously coming normal. Slight relief in the pain in breast before periods. There was slight relief in the pain in breast before the periods. Brainia, a morning empty stomach, and Calcarea floricum 6x because of the fibroadenoma was also started once a day due to character of hardness of the lumps. So first the miasm was removed with carcinosin 1M, then Brainia and Calcarea flor came into the picture. No change in lump, waiting for the next periods to see change in the character of pain. Obviously, the mass will not go away very easily, but the pain will should start to reduce. And placebo with Calcarea flor 6S was prescribed for the next 15 days. Second period after starting of homeopathic medication, pain in breast better by 30%. Also, no pain in abdominal region. So there, the pain in the abdominal region she was having during the periods that started to go away, and the pain in breast were also better by 30% on the fourth follow-up. Lump size also better, and hardness because of the Calcarea flor we see hardness coming down and pain also coming down. Placebo with Calcarea flor again 6S for 15 days. Fifth follow-up showed breast lump reduced by almost half size. Brinia 200 single dose. So after the reduction in the size, Brinia single dose was every day again repeated with Calcarea flor in evening for the next 15 days. Third time periods arrive after medicines. Breast pain almost 75% less, and breast lump size is reduced by 50%. Calcarea flor 6 is again prescribed along with placebo. So the Brinia we gave only 2 or 3 times, but the result was quite good. And the patient was advised again to go for CT scan. CT scan reveals 50% reduction in fibroadenoma and fibrocystic size. So here we see we used 3 medicine, but the effect was took up a bit of time. But after 3 cycles, there was almost 50% reduction in the size of the patient. The patient is still coming up with me, and she is quite better, but the fibroadenoma is almost half. But again, I have started again with the carcinosin 1M dose, and Brinia has been continued right now. So we'll see that follow up. I am keeping up, and I hope to see that it is cured almost completely. So these were the two cases which I've shown about fibroadenoma and fibrocystic, focusing more on the fibrocystic cases. I hope I have just done justice to the topic, and I'm really sorry there are quite a spelling mistakes in the slides because I made them very quickly. So sorry for that. And hope I have given some knowledge sharing on this session. Thank you.
Thank you, Dr. Neha. And we have 8 minutes. If anybody is having questions, please raise your hand and ask question. Dr. Manoj, please.
Yes, thank you, Dr. Ajini and Dr. Neha Kakkar. Nice presentation, but I think an element of doubt should be there in such cases, because so what happens as a result of striking herself with the breast. The patient is often using the right-handed person, naturally she will strike with some frustrations or anger. In some cases, you should have a doubt of element there. In that
Yes,
case,
sir.
conium is a most effective medicine.
Yes.
Whereas the other things are very okay, quite natural, okay, but
Yes.
you always suspect the most probable exciting cause there. Thank
Yes,
you.
yes. Okay, okay.
Thank you, Dr. Manoj. Dr. Beatrix.
Yes, thank you very, very much, Dr. Neha. I'm talking from
Yes, thank
Germany. It's very, very interesting, your presentation,
Thank you,
and
ma'am.
very well structured, we can learn a lot about the anatomies, the forms, the differences between
Yes.
fibroadenoma and fibrocystosis. Very, very interesting. And for me, it was new to see that connection with overweight and
Yes.
food. And that's very interesting to see and to advise the patients.
Yes.
And very special. Thank you very much for that information too. And one little question. You were talking about lycopodium to give for nodosities. Yes. And you said it was on the left side. It's more left side nodosities. But normally, as I know, lycopodium is more right sided remedy. Is that special on that breast conditions? With
No,
lycopodium left?
No, I guess to see that lycopodium can be used both on the right and the
Yes.
left side. Obviously, they cannot be, we cannot say that we use only on the right side or on the left side. More of the characteristic, picture of the lycopodium needs to be taken. As I said, the patient needs to be more, introvert in nature and having digestive complaints, having desire for sweets. Right and left, in my clinical practice also, I've seen that this is the last point we need to see, that whether it's right or left side. But as I've mentioned in that case of Brinia, more of a, that stitching pain came up, and as Brinia is also a right sided remedy, but this thing needs to be taken at last only. But for the mentioning sake, I have mentioned that it can be used in the left side of the breast.
Yes, thank you very much.
Okay.
Thank you, Dr. Beatrix. Anyone have questions?
What about the diet and regimen in such cases? What are your advice to avoid or to activate
Yes,
the
as I have
cases?
told earlier, so that junk food is and the packed food that is coming up is the main basic cause that causes hindrance in our treatment also, and it can lead to the complaints coming up again, and the result not getting the treatment getting delayed. So the main advice dietary I gave is of avoiding more of junk food and packed food, and focusing on fiber based diet, where the patient should take more of vegetables, and also avoid dairy products, the pastries and bakery products should also be avoided, and more fibrous weight based diet like of fruits, vegetables should be taken in these cases, because that can lead to weight reduction also, and obviously the hormonal cycle also get affected by the dietary changes that are coming up. and can lead to improvement in these cases. I have seen whenever you suggest these dietary changes, the bulkiness of the breast is also reduced, because a fat based, more of a junk based and fat based diet tend to increase the bulkiness and the supportive structure, because it is made up of fat. The breast structure is made up of fat, more of fat. So if you introduce more of fat, that gets deposited in that area and can lead to increase in the tenderness and pain in the patient. So fiber based diet of fruits, vegetables, and more of water intake can lead to decrease in this bulkiness and pain symptoms also. So this kind of diet we always advise. And obviously exercises of mostly like yoga and specific asanas are also advised to this patient, which can lead to weight reduction also, and more of blood circulation is happening due to the exercise, and that can also lead in improvement of
I
the symptoms.
think the role of groundnut is very much questionable here. The groundnut always causing some kind of this fibroadenosis in case of females. As I
Groundnut.
suspect, yes, yeah.
Okay. Yeah, but I guess groundnut is a protein, more protein based thing, and it can be taken in moderate amount. I cannot say that it can cause fibroadenoma and fibrocystic disease as per se, but obviously everything should be taken in moderation, in my opinion.
Yes, no homeopathists would say this diet will cause disease, because we know that all the diet, they are only exciting causes.
Yes, yes, obviously it's a risk factor like thing, and they need to be kept in mind, so that we can get a given adjuvant treatment to the patient along with our homeopathic medicine. As Dr. Henneman has also mentioned, that dietary restriction and all those things should be always taken care of. So, and mostly in these fibrocystic and PCOD cases, we need to keep these things in mind.
Yes, in that case, Animal advises not to disturb the medicinal action. He advises this diet and regimen. Yes, okay.
Yes.
Thank you. Thank you, Dr. Neha, for your answers. Now it is time to wind up the session.
Yes.
I'm inviting Abdul Salam from Qatar.
Dr. Beatrice is now. Yes.
Dr. Beatrix, sorry. Dr. Beatrix, please.
So, Dr. Beatrix for giving
Okay.
Okay,
So
okay.
one little comment on that on the diet. My patients in my clinic, I have very few patients with overweight. All our homeopathic patients are more or less slim, which is interesting. Okay, but very good that idea, and thank you so much, Dr. Neha, about your very clear and very also scientific presentation. And we also feel your
Yeah, obviously there
dedication.
can be exceptions. I have told mostly about my experience. Obviously thin patients can also have a fibrocystic disease, obviously,
Yes, yes,
but
yes.
mostly around in nowadays I am coming upon more of fatty and obese patients, because of the, I guess, sedentary lifestyle that is coming up.
Yeah, I understand very well. Yes, so thank you very much for your very nice presentation, and thank you very much all people
Thank
from
you so much.
IFPH to join.
Yes.
And I also have to wind up because some patients are coming now.
Yeah,
All the
sure,
best
ma'am.
to you.
Sure, ma'am.
Greetings
Thank
from
you. Thank you
Germany.
so much, ma'am.
Love to India. Yes.
Yeah,
So,
thank you.
bye
Thank you
bye.
so much.
Thank you, Dr. Beatrix. Thank you, Dr. Neha. Now it is time to move to Malayalam session. I am inviting Dr. Manoj for moderating Malayalam session. Dr. Manoj, you are welcome.